Welcome to The Explainer. Today we're diving into one of medicine's most dramatic and urgent events, pulmonary hemorrhage. That's bleeding inside the lung.
So here's our game plan. We'll start with that first alarming symptom. Then we'll get into why the lung actually bleeds. After that, we'll look at how doctors race to find the source, the incredible ways they stop it. And finally, we'll zoom out and see what it all means.
Okay, this is one of the scariest things you can see in medicine. So let's get our terms straight right away to really understand what's going on.
Seeing blood when you cough, that's an immediate, major red flag. That symptom, which doctors call hemoptysis, tells you that something serious, a bleed, is happening somewhere inside your lungs or airways.
Right, so while hemoptysis is the symptom you might see, pulmonary hemorrhage is the actual event. It's the bleeding itself happening deep inside. And make no mistake, this is a critical medical emergency.
And this number, wow, this really drives home just how high the stakes are. A mortality rate that can be as high as 30 to 40%. This is a true life or death situation where every single second counts.
Now, this is a subtle point, but it's absolutely crucial. The hemorrhage is the internal event. Hemoptysis is just the most common outward sign. You could actually have a pretty significant bleed without coughing up any blood at all, especially if it's really deep in the lungs.
Doctors also have to play detective, and fast. Is the blood coming from the lungs or from the stomach? They look for key clues. Blood from the lungs, it's usually bright red, kind of frothy because it's mixed with air, and it's alkaline. Blood from the stomach, on the other hand, looks more like dark coffee grounds, thanks to stomach acid. And its pH is, you guessed it, acidic.
So that's the what. Now for the big question. Why? Why does the lung bleed in the first place? To get that, we've got to look at its really unique anatomy.
This is so fascinating. The lung actually has two totally different blood supplies. Think of the bronchial arteries as high-pressure fire hoses. They're at full-body blood pressure and are the source of an incredible 90% of massive bleeds. Then you've got the pulmonary arteries, which are more like low-pressure garden hoses. They just don't bleed as often or as violently.
You know, the bleeding itself is almost always just a symptom of something else going on. It could be infections like TB, it could be cancers, or even autoimmune diseases. But what's really wild is that in up to half of all cases, even after tons of tests, doctors, they never find the cause. It's just a mystery. They call it cryptogenic.
And the most likely culprit? Well, it really changes depending on where you are in the world. Globally, tuberculosis is still the #1 cause of coughing up blood. But here in more developed countries, cancer actually becomes a more common reason.
Okay, so you've got all these possible causes. The clock is ticking. Finding the exact source of that bleed turns into a systematic race against time.
The medical team has a very clear playbook, and it always starts with the basics. Stabilize the patient. We're talking airway, breathing, and circulation. Once the patient is safe, they'll run labs, start imaging, maybe a simple X-ray, then a super high-res CT scan for a detailed roadmap of the blood vessels. And if the bleed is still playing hide-and-seek, they bring out the bronchoscope, a camera they send right down into the airways to find the exact spot.
Now here's a really clever diagnostic trick. If doctors think the bleed is widespread, deep in those tiny air sacs, they'll wash a little section of the lung with saline. If the fluid they pull back gets more bloody with each wash, bingo, that confirms the bleed is diffuse all over the place. Pretty neat, right?
All right, the source has been located. Now the focus shifts immediately to the most critical task of all, stopping that bleed.
Okay, listen to this, because it's one of the most important things to understand. In a massive lung bleed, the biggest danger isn't bleeding to death, it's suffocating. The blood literally fills up the airways and blocks off oxygen. And knowing that changes everything about how you respond.
Right, so because that risk of suffocation is so high, job #1 is always managing the airway. A simple but incredibly effective first move is just positioning the patient. You lay them on the side of the bleeding lung. Gravity then does the work, helping to keep the blood contained and, most importantly, protecting the good lungs so the patient can keep breathing.
So the go-to treatment for severe bleeds is a procedure called bronchial artery embolization, or BAE. It's minimally invasive, but just think about how precise this is. A radiologist guides a tiny, flexible catheter, usually from an artery in your leg, all the way up through your body and steers it directly into that one specific bronchial artery that's bleeding. Then they inject microscopic particles to basically build a dam and stop the bleed right at its source. It's just incredible.
Now, BAE works. It has a super high success rate for stopping the bleed right away. But the story doesn't end there. The bleeding can come back in up to half of all patients. And that's usually not because the procedure failed. It's because the underlying disease, that infection or that tumor, is still there, causing the body to grow new, fragile blood vessels that can also break.
So after all that, what's the big takeaway? What's the bigger picture here? Let's bring it all together.
So when you put it all together, you see that pulmonary hemorrhage is this terrifying symptom, but it's not the disease itself. Stopping the immediate bleed with amazing tools like BAE is just step one. The only way to get a real long-term fix is to find and treat the root cause, and that's why you need a whole team of specialists, intensivists, pulmonologists, radiologists, surgeons, working together.
And this all leaves us with a final, really important question to think about. Since we've gotten so good at controlling the symptom, at plugging the leak with techniques like BAE, the real challenge, the next frontier, is actually conquering the chronic diseases themselves. The cancers, the infections, the autoimmune disorders that cause the lung to bleed in the first place.